Hello and welcome. This is Janlata Bhattrai from Singleworldnews. Each year during Mental Health Awareness Month, individuals and organizations come together to share their experiences, resources, and knowledge about the various mental health conditions and the impact they can have on people and their families. By encouraging open conversations and promoting self-care practices, society has increasingly reduced the long-fought stigmas around mental health. One aspect of treating mental health that is also losing its negative stigma is cannabis. There is growing evidence that cannabis may have both risks and benefits for mental health, including the treatment of anxiety, depression, and post-traumatic stress disorder. However, because of the federal prohibition of cannabis, there is a severe lack of research in this area. In order to fully understand the potential benefits and risks of cannabis on mental health, we need a federal framework rooted in science that allows for more research to be conducted. The state of cannabis research currently, cannabis is prohibited, and despite strong legislative efforts, remains difficult to study in a clinical setting. Even when researchers obtain permission to conduct studies, they are often limited in the types of cannabis products they can use, the dosage levels they can administer, and the number of subjects they can include in their studies. Still, what research does exist shows that this will be a complicated issue worthy of careful scientific pursuit. Cannabis research suggests promise and perils for the treatment of anxiety and post-traumatic stress disorder. This complexity comes from the fact that cannabis is not one thing. It can be high potency, low potency, and be accompanied by a number of novel cannabinoids that may change the effect of the drug. Additionally, no two people are the same, and genetics and environment may play a large role in how cannabis affects an individual. Today, over 150 million Americans have some form of access to cannabis, and as more states take step towards legalization, the perception of risk and harm continues to drop, fueling the belief that cannabis is a benign substance. While it is true that many use cannabis without severe consequences, it is essential to acknowledge that each person has a unique degree of risk based on factors related to the cannabis products they are using and their characteristics. Ultimately, a federal framework led by science would help ensure we have a better understanding of the potential benefits and risk of cannabis on mental health. This knowledge could then be used to inform public policy and help to improve the lives of millions of people who suffer from mental health conditions. If you want us to cover more news for you, then please do let us know in the comment section below, and don't forget to like, share and subscribe this video. Subscribe our channel. Please press the bell icon for the latest notifications. Stay connected with us, guys. Please keep supporting us. We really need this. Thank you so much.